Welcome to The Explainer. Have you ever wondered why a pill that works wonders for your friend's headache does absolutely nothing for yours? Well, today we're diving deep into the pharmacology of headaches to figure out exactly why the right treatment is all about targeting the right cause. So, that is the big question, isn't it? And, the answer is actually pretty simple. Not all headaches are created equal. They have totally unique biological triggers. Using the wrong drug is, well, it's like trying to use your car key to open your front door. It's just not going to work. So, really, we're dealing with three completely different problems here. You've got a neurovascular storm happening with migraines, you've got muscle tension at the heart of tension-type headaches, and then you have this haywire brain clot causing cluster headaches. Each one needs a totally different toolkit. Okay, let's tackle the first one, the migraine. And seriously, forget what you think of as just a bad headache. This is a full-blown neurological event. It's a literal storm of brain activity, inflammation, and chemical chaos. When a migraine hits, you have to act fast. Time is absolutely of the essence. Acute therapy is all about firefighting. You've got to put out those flames before they have a chance to spread and take over the entire central nervous system. And here's where that precision really comes into play. You've got NSAIDs like ibuprofen. Their job is to cool down the inflammation. Then you have triptans, like sumatriptan, which do double duty. They shrink those painfully swollen blood vessels and, this is huge, they block the release of a pain signaling molecule called CGRP. The discovery of CGRP's role was a total game changer, leading to a whole new class of drugs, the CGRP antagonists that go straight to the source and just block that pain signal directly. It's like having a specific tool to dismantle each part of the migraine. So when do you switch from firefighting to fire prevention? It's a really critical question because having too many of these attacks can actually start to rewire the brain, making it even more sensitive to pain over time. The tipping point for starting prevention is basically when migraines start running someone's life. We're talking 4 or more really bad attacks a month, or when the acute treatments just aren't cutting it anymore. Or, and this is a big one, when you're taking rescue meds so often that that becomes its own problem. That's the signal that it's time to build a solid defense. And that is exactly where preventative therapy comes in. Instead of just putting out fires, the goal is to stop them from ever starting. You're trying to calm that overactive migraine brain. Think of it like you're building a firewall to block future attacks. And look, the tools for prevention are completely different. You've got beta blockers like propranolol that just kind of calm the brain's overall excitability. You have antidepressants like amitriptyline that actually boost your body's own natural pain-fighting chemicals. And then you have drugs like topiramate that prevent something called cortical spreading depression, which is basically a slow-moving wave of electrical chaos in the brain that causes aura. It's a complete shift in strategy, from reacting to attacks to proactively keeping the brain stable. Okay, let's switch gears and talk about the most common headache out there, the tension type. Now, here we're not dealing with a brainstorm. This is something much more physical. It's muscle tension that, over time, can actually make your central nervous system more sensitive to pain. The good news is, for an occasional tension headache, the treatment is usually pretty straightforward. The goal is simple. Ease up that muscle tension, and the pain should go right along with it. The go-to here is usually an NSAID, something like ibuprofen, because it targets the pain coming from those tight muscles. But here's a really, really crucial warning. You want to stay away from opioids. They just don't work well for this kind of headache, and they can actually turn what was an occasional problem into a chronic daily nightmare. But what happens when occasional turns into almost all the time? Well, that's a sign that something fundamental has changed. The pain system itself has gone into overdrive. It's a state we call central sensitization, where everything just becomes overly sensitive. The official line in the sand is this: 15 or more headache days a month for at least 3 months. Once you cross that line, it's considered a chronic problem, and that's when you have to start thinking about long-term prevention, because now the nervous system is basically stuck on high alert. The best defense here is really a 3-pronged attack. So you might use a low-dose antidepressant like amitriptyline to help turn down the volume on the pain signals in the brain. But it's just as important to tackle the root cause, right? That means physical therapy to release all that muscle tension and stress management to help calm the whole system down. All right, now we have to turn to what many consider the single most excruciating pain known to medicine, the cluster headache. I mean, its nickname is the suicide headache, which that tells you everything you need to know about its severity. This is not just a headache, it's a neurological explosion triggered by a malfunction in the brain's master clock, the hypothalamus. When pain goes from 0 to a 10 in just a few minutes, your treatment has to work even faster. A standard pill is completely useless here. That's like trying to catch a speeding bullet with a butterfly net. It's just too slow. The treatments for cluster attacks are as extreme as the pain itself. First line is high-flow 100% oxygen. It works by calming down that overactive nerve pathway, the trigeminal autonomic reflex, that causes both the stabbing pain and other symptoms like a tearing eye. The other main option is a super fast-acting injection of sumatriptan. Notice what's missing? Standard painkillers. They just don't work on this kind of neurological event. With cluster headaches, prevention is not a choice. It's an absolute necessity. The whole goal is to shut down the entire cycle of attacks before it can even get started, because these things can last for weeks or even months at a time. The cornerstone of prevention here is a drug called Verapamil, which helps to stabilize that haywire brain clock we talked about. For really tough cases, there's lithium. And to get immediate control, doctors often use corticosteroids as a bridge therapy, something to quickly break the cycle while the long-term meds kick in. And here is a safety warning that you just cannot ignore. The doses of Verapamil you need to control cluster headaches are really high, and they can affect the heart. So regular ECG monitoring is absolutely essential. It's a powerful tool for sure, but it has to be used safely. Okay, so what does this all mean when you put it together? Let's boil it all down into a simple, clear treatment playbook. Look at this. It really all comes down to matching the right tool to the right problem. A triptan for that migraine storm, an NSAID for the muscle tension, and high-flow oxygen for the cluster attack. 3 totally unique headaches, 3 incredibly precise solutions. So what's next? Where do we go from here? We've already gone from these one-size-fits-all painkillers to highly specific drugs that target the actual molecules of pain, like CGRP. As we keep unraveling the mysteries of the brain, the future of headache treatment is becoming pretty clear. It's going to be more personal, more precise, and more powerful than ever before.